Hi, good afternoon. My name is Missy, and today I want to talk about colon cancer screening. This presentation is meant for, I don't know, maybe my friends on Facebook, where I would be posting that as an awareness for colon cancer. So, as you know, colon cancer is really big in the United States, and cancer in general is the second leading cause of death here in the United States. Um, so I want to take some time and remind you and give you a little bit of information to help take care of yourself. So, what is colon cancer? Basically, colon cancer is cancer that starts in your colon and rectum, and usually the cancer is usually in the lining of your large intestine. No symptoms in the early stages, and the way to diagnose with colon cancer is to have a screening colonoscopy. I mean, there are other ways, like you could do a stool fecal test, these kind of tests, or you could do a virtual colonoscopy. Um, and But if any of these other tests come positive, you must follow it with a colonoscopy because it is the ultimate way of diagnosing colon cancer. So some facts about cancer. It affects about 200,000 people in the United States yearly. The early stages are non-cancerous polyps. So when you have a colonoscopy, they see polyps, they remove them, they biopsy them, then they come back as either um, benign, precancer, or cancer. So colon cancer is treatable depending on the stage, size, and location. And treatments include surgery to remove the cancer, the tumor, um, radiation therapy, chemotherapy. Symptoms depending on the location, size, and stage. You may experience no symptoms at the beginning, then as it progresses, you might have changes in your bowel. Like, for instance, you might be constipated or have diarrhea, or your stool might not be consistent at all. It might look like a narrowed, small, like a narrowed kind of stool. You might have blood in your stool, abdominal discomfort, gasping, nausea, vomiting, bloating. That's the biggest thing. Normally, people complaining of fatigue and anemia. And usually, the people that's involved in your care, once you find out you have colon cancer, normally you would already work with your primary care doctor, then the stomach doctor, which is the GI doctor. Then they would send you to see an oncologist, and the oncologist then would send you to see a surgeon. So, and then also the pathologist who does all the studies on the samples, like the polyps that they remove or the tumor. There's the radiologist who study all of the tests that you have done. Who should get screened? According to the American Cancer Society, all people should have access to colon cancer screening, regardless of health insurance coverage, race, or background. So everyone should be tested. But the standard is for you to start getting your screening colonoscopy by the time you're 50. Then if you have any risk factors like family history or whatever, then you need to start at 40. Then your doctor will determine a schedule for you of how often you need to get tested. Let's see. We talk about all the tests that need to get done. If any of them are positive, then you must have a colonoscopy. You're never too young. That's what I want you to catch with this video. You're never too young to get colon cancer. I want to share a personal story. Like a year and a half ago, I was just maybe 2 years ago. I was sick a lot with a lot of stomach symptoms like bloating, abdominal pain, nausea, these kind of things. But finally, in the middle of all that going on, I had a gallbladder attack, which really was the greatest thing that happened to me because then since they removed my gallbladder, I was still having the same symptoms. You know, my doctor, my GI doctor, was a very good doctor who listens. So he went ahead and scheduled a colonoscopy and an endoscopy. And so we did that. Then I came back, you know, and he's like, let me ask you a question. Why do you have precancer cells at your age? I was only 38 years old. And I could just drop dead, you know, just thinking, oh my God, because at that time, I have a very good friend of mine who was going to colon cancer. And for the last 3 years, she was fighting with colon cancer. And I even took care of her as a patient in a cancer center that I work at, which really messed up with my head. But anyway, she was always encouraging all of her friends to get screened. And a year and a half after this whole thing happened with me, I was so grateful that I got sick and I had to have a colonoscopy, because if I didn't do that, by the time I'm 50, then I would do a colonoscopy, I would probably be dead. Not, I'm pretty sure I would be dead or something. So my friend, a year and a half later, she died from colon cancer, and which make it even tougher on me, because I kind of feel guilty, because it could have been me, because she's the same age as me, she has a family, you know, so I feel bad. But my point is, my friend always encouraged all of her friends. She always say, check your booty. Yeah, every year she would send a message. She would be like, check your booty around colon cancer awareness. So, and she always encouraged, she say, if you don't feel well, go back and keep on going back until they do something. Because eventually you are in control of your health. You know, the doctors are not in control. You know your body better. So ask for another test. Keep on going back. Keep on insisting. See another doctor. You know, get a second opinion. Even if you have to pay for the second opinion visit, get it. But most insurance would pay for you to get a second opinion from a different doctor. So, as I said, this is like something that's really close and dear to my heart, because even now, every day, I'm waking and thinking, what's going on with my body? Because from now on, I need to get screened every 3 years. And, you know, just thinking, waiting for 3 years to find out what's going on with you, it's mind-boggling. So at the end of the year, I would be having that colonoscopy again. And it will be a tough thing, because I'll be thinking of my friend who's gone. So, but take care of yourself, take care of your body, get your booties checked. Thank you so much. See you later.